Hello students, am I audible? Yes. Okay. Okay, fine. Am I audible? Fine. Okay. Now we will start this session. I will start the session. This is demography. We'll start with this FMGE, this live session, and we will start with the important topics first. Am I audible, guys? The people in the chat box, they can mention it. Let us start. This is PSM. We are going to teach PSM. As you all know that, so in your exam of FMG exams, so you will get roughly around some 30 questions you will get from this subject, roughly 30 questions. And most of the questions come from, almost all the questions come from the textbook of Park. So we are going to discuss these previous year questions, and so we'll try to cover as much as possible. Okay, and other things you can go through from the app, guys. Right. So if you have any queries or doubts, okay, you put it in this chat box. Okay, we will discuss today some amount of topics. Tomorrow we'll discuss some amount of topics. Okay, fine. Hope this is fine. Now we'll go to the question. Answer this question, guys. The most popular fertility indicator among the following is what? Which is the most popular fertility indicator? You can use this. Yes. Answer. Okay, fine. The most popular fertility indicator is, okay, these two are the fertility indicators. One is, the answer for this question is TFR. TFR is the answer. So two important fertility indicators among all the topics. Demography in the past few years, what I have seen, is the most important topic. In every exam, 4 to 5 questions. Total fertility rate. Okay, total fertility rate. TFR means total fertility rate. Total fertility rate. Okay, fine. What is this total fertility rate? Total fertility rate indicates, okay, number of children born to a woman in her lifespan. Okay, this is the total fertility rate. Number of children born to a woman in her lifespan. What is NRR means? Our target for TFR is, so less than 2.1. Okay, so our target is less than 2.1, and we want to achieve, and India has achieved it actually. Okay, India has achieved. So the other one is that, what is NRR? NRR means net reproductive rate. Okay, what is net reproductive rate means what? What is net reproductive rate means? Number of girl children. Okay, number of girl children born to a woman. Okay, based on current fertility and mortality. Okay, based on current fertility and mortality. Okay, and mortality. This is NRR, guys. Okay, net reproductive rate. Our target, okay, you can post it in the chat box. You can post it. Okay, fine. Our target is that NRR should be 1. Okay, so number of girl children born to a woman based on current fertility and mortality. So that is net reproductive rate. The other one is total fertility rate, is number of children born to a woman. So out of this, which is more important is this total fertility rate is more important, guys. TFR is more important, and that is the most popular indicator. Okay, fine. Okay, we'll go to the next question, guys. We'll go to the next question. Fine. One more indicator is there, that is gross reproductive rate. What is gross reproductive rate? Gross reproductive rate is number of girl children. Okay, anyway, I'll send this PDF to you. Okay, you just answer the questions, guys. You just answer the question. PDF, I will send it to you. Number of girl children born to a woman based on current fertility, assuming no mortality. So we are not taking into consideration mortality, guys. Number of girl children born to women based on current fertility, assuming no mortality. This is gross reproductive rate. Okay, as far as your exams are concerned, it's a very important chapter. This is demography. Out of all chapter, I feel this is the most important chapter. Fine. Girl children based on current fertility, assuming no mortality. Fine. Answer this question, guys. Okay, fine. Next question. See the image and identify what it is. Okay, fine. What is this? Yes. Okay, the answer is already there. Okay, this is actually a demographic cycle. Okay, this is demographic cycle. All countries will go through this cycle, guys. Okay, this is demographic cycle. All the countries in the world, they go through this cycle. Fine. Now here in demographic cycle, it is based on birth rate and death rate. This is what is given. Okay, one is birth rate, another one is this is birth rate. This is the second one. This is death rate. It is based on birth rate and death rate. It has so many stages. It has so many stages. One is high stationary. High stationary means country is having high birth rate and death rate. Look at here. The birth rate is also very high. Death rate is also very high. Early expanding. The next phase is early expanding. Birth rate is high, but death rate started declining. Okay, this is death rate started declining. This is early expanding. The third phase is both birth rate is also declining, death rate is also declining. This is called as late expanding. Okay, fine. So high stationary, early expanding, and this is late expanding. And the fourth stage is both are low here. Birth rate is also low and death rate is also low. That is low stationary. And finally, what happens is birth rate is lower than that of death rate. The fifth phase is called as declining phase. So am I clear? So every country will go through this phase. So high stationary, that means birth rate is also high, death rate is also high, and early expanding. Death rate started declining, late expanding, both are decreasing, and low stationary is there, both are low, and finally birth rate is lower than that of death rate. That means number of people born in a year is less than that of number of people died in a year. This movement, what is this is called as, the answer for this question is demographic transition. Okay, as the country improves socio-economically, okay, as the country develops socio-economically over a period of time, so they will go through from high stationary to low stationary and declining. Okay, so India is in which stage? The next question is, India is currently in which stage? India is currently in low stationary, guys. Not low stationary, late expanding. Okay, so India is currently in late expanding. Fine, late expanding. Fine. So these are the stages, and this change from one phase to another phase, this we call it as, what we call it as? Yes, this we call it as demographic transition. Okay, fine. We'll go to the next question, guys. We'll go to the next question. Fine. Come on, answer it. Some of you are seeing it. Okay, you can answer it. Fine. In a population of 10,000, the sex ratio is more than 1,000. Which is the correct statement? Which is the correct statement? Okay, fine. So what is the formula for sex ratio? Formula for sex ratio is number of females to number of males. Number of females to number of males. Okay. So according to 2011 census, India's sex ratio is 940 per 1,000 males. Okay, for every 1,000 males, okay, we are having only 940 females. Okay, because of sex selection. Okay, female feticide, infanticide, all these things are there. Okay, now answer the question. Okay, you can answer it yes, fine. Now what is given here is the sex ratio is more than 1,000. What does it mean? The population is 10,000. Sex ratio is more than 1,000. What does it mean? It means more females are there in the community. Okay, more females, right? That is the interpretation, right? There are more females are there in the community. Now we will go one by one. We will see what is the answer here. Okay, fine. Okay, more females. Okay, so this is 10,000. So both will not come because they are talking about 500. That is not going to give a meaningful interpretation. Okay, now tell me what is the answer. Okay, what is the answer? Okay, I said more females are there. Okay, more females means, so this is also wrong. Okay, so that means females are more than 5,000 should be there. Okay, so answer for this question is males less than 5,000. Can answer for this question males less than 5,000. So am I clear? So this is the formula. Okay, the concept is same, but they are asking it in a different way. That's it. Okay. So in a population of 10,000, the question is population of 10,000. So sex ratio is more than 1,000. That means more females are there, means less males are there. Next. Absolute contraindication of IUCD are all except should come here. Okay, except should come. Okay, except. What are the absolute contraindication? Okay, fine. One is suspected pregnancy. Okay, so suspected pregnancy is a contraindication, guys. Suspected pregnancy. Okay, second, what else? PID. PID is a contraindication. Suspected pregnancy and PID is a contraindication. Third, what else? Hemorrhage. Okay, hemorrhage, vaginal hemorrhage of vaginal bleeding of unknown etiology. Vaginal bleeding of unknown etiology. Okay, vaginal bleeding of unknown etiology. Okay. Previous ectopics. Previous ectopic pregnancy. Previous ectopic pregnancy is a contraindication. Okay, previous ectopic pregnancy is a contraindication. And fifth one is, okay, CA cervix, uterus. So these are some of the contraindication, guys. These are some of the contraindication. CA cervix, uterus or adnexa. These are some of the contraindication. Now, the common IUCD we use in our program is called as Cohort 380A. What we use in the program is Cohort 380A, guys. Okay, what we use in the program 380A. So how long it can be used? It can be used for 10 years. Okay, it can be used for 10 years. 10 years it can be used. Okay, fine. Now what is the answer based on this? All are absolute contraindication for IUD except. So I think history of PID you should not give. Previous ectopic pregnancy you should not give. So let us assume this unexpected uterine bleeding. Okay, so that is also we should not give. Vaginal bleeding of unknown etiology. Okay, fine. So possible answer for this question is, okay, fibroid. Okay, possible answer is this one. Okay, small size fibroid. So all others are right. Okay, all others are right. So you should not use history of PID, previous ectopic. Okay, vaginal bleeding of unknown etiology is there. Okay, fine. Next. Next question. All are true about vasectomy except NSV means okay, no scalpel vasectomy. All are true. What is wrong here? What is wrong? It's a form of permanent sterilization, guys. It is a form of permanent sterilization. Okay, to do it, the male should be between 25 to 50 years, and he should be having 2 living children should be there. 2 living children should be there, and they should be between 25 to 50 years, right? Now you are going to do vasectomy, that is no scalpel vasectomy. Okay, so all are true. Recanalization possible, that is true. Second, use contraceptive for 3 months or 12 weeks or 30 ejaculations. They are not immediately sterile, guys. Understand this. They are not immediately sterile. Okay, they are not immediately sterile. Okay, use some other method of contraception for 12 weeks or 30 ejaculations, and it is a permanent method of sterilization. All are right here. So what is wrong here? Yes. So they are not immediately sterile. Sterility is soon after vasectomy. No, they are not sterile, guys. Okay, so following vasectomy, they should use some other method of contraception for 12 weeks or 30 ejaculations. Okay, fine. We will see the next question, guys. We'll see the next one. Okay, answer this question. Read the question carefully and answer. Come on, start participating. Answer it. A 20-year-old low socioeconomic female present within 8 hours of sexual assault, okay, on 13th day of the cycle, okay, so around mid-cycle, asked for emergency contraception. Okay, the question is on emergency contraception. What is your advice? Okay, fine. So our what we do in our program, okay, so in our program we give, the first one is levonorgestrel. Okay, we give levonorgestrel. LNG means levonorgestrel. Okay, so we give 2 tablets. We give 0.75 milligram, 2 tablets. Okay, first 1 tablet. Okay, again we have to give 1 more tablet after 12 hours. So this has to be completed within 72 hours. Okay, within 72 hours of unprotected sex. This is what is the name we give it in the program. The name of the pill, yes, the name of the pill is Easy Pill. It is available in the program, guys. It is available in the program. The name of the pill is Easy Pill. Easy Pill. Okay, fine. Now, second, what else we can do? We can give OC pills. 4 tablets, again 4 tablets within 72 hours. This you can give. Third, you can give OC pills, 2 tablets, high estrogen dose. High estrogen OC pills you can give within 72 hours. This is also you can give. High estrogen dose OC pills. This is also you can give. Okay, and fourth one is, come on guys, start messaging. Okay, I just want to know whether you are able to follow or not. Okay, fine. High estrogen dose. And fourth one is, you can give mifepristone. 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 Okay, you can give mifepristone, you can give. Okay. Mifepristone you can give for 10 milligrams stat you can give. Mifepristone 10 milligram, only 1 tablet you can give mifepristone, and this is also has to be given within 72 hours. 72 hours you have to give. And the fifth one what you can give is IUCD you can insert for 5 days. Okay, IUCD you can insert it for 5 days. 5 days. So am I clear? So these are the various methods you can use. You can use all the methods you have to use within 72 hours. Only IUCD you can use it for 5 days. Okay, now can you tell me what is the answer here? What is the answer? What is the answer for this question? Yes, the answer for this question is LNG, guys. Okay, LNG 1.5. LNG 1.5 milligram in 2 divided doses you can use. Okay, so within 72 hours you can use it. LNG you can use it. Okay, next. Okay, so we'll go to the next question, guys. We'll go to the next question. Okay, fine. So you're answering, fine. You're answering. Okay, you're answering. Okay, fine. We'll go to the next question, guys. We'll go to the next question. What is the answer for this question, guys? What is the answer for this question? Contraindication of the device shown in image below. Fine. What is the answer for this question? Contraindication. Yes, this is copper T. Copper T 380A, guys. Okay, this is copper T 380A. Okay, fine, right? This is copper T 380A. Okay, so what is this copper T? Okay, fine. Just a minute. Hello? Yes? Okay. Okay, fine. Now, this is copper T 380A. And we already seen, okay, this PID is an important contraindication, absolute contraindication. Okay, PID is an absolute contraindication. What is this 380 means? What is this 380? 380 means surface area of copper, okay, in square millimeter on the device. Okay, surface area of copper in square millimeter on the device, guys. Surface area of copper in square millimeter. Okay, fine. But this is the thread. This is the thread. How much copper? This is what we are discussing. How much copper is there? Currently in the program, what we are using is copper T 375 we are using. This can be used for 5 years. Newer one we are using. And this 380 can be used for 10 years. 10 years. Okay, it can be used for 10 years. Okay, are you able to follow this? Okay, so please message. Okay, the pace is fine. Any difficulty, you just message me. Okay, fine. Okay, we'll go to the next topic, guys. We'll go to the next topic. So that is demography. We will go. So demography we completed. We will go into epidemiology, guys. Epidemiology. Okay. What is PK? PK means where, guys? PK means where? I'm not getting your question. Okay, fine. Now, so you go into epidemiology. Okay, so the question here is, answer this question. Answer this question. The intern has to study the relationship between ordering food online and development of obesity. Development of obesity using case control study. Best study groups to be involved. Okay, fine. Listen, the question is a case control study. Case control study start from where to where? Answer this. What is this? Case control study will start from where to where? Exposure to outcome or outcome to exposure? Yes, case control study will start from outcome to exposure, right? It starts from outcome to exposure. Okay, fine. Now, so here they are taking exposure as ordering food online. This is the exposure. And what is the outcome? Obesity is the outcome. Okay, obesity is the outcome, right? So what is the answer for this question? Yes. So you have to take, okay, this is the population. From the population, cases and controls. Okay, right? So here cases means obese people, controls mean non-obese people. Then you ask about ordering food online. Okay, food online you are going to ask. Okay, this is what you are going to ask. Okay, so what is the answer? Yes, so the answer for this question is yes, obese and non-obese persons. Okay, obese and non-obese person. Okay, next question. What you can find in a case control study? A case control study, what you can find is odds ratio. By doing a case control study, you can find is odds ratio. It indicates what? It indicates strength of association, guys. Okay, it indicates strength of association, right? Equal to 1 means, or OR means odds ratio. Equal to 1 means no association. No association. More than 1 means positive association. Less than 1 means negative association. Mostly ordering food and obesity may be a risk factor. So that means positive association. Okay, positive association may be there. Smoking and lung cancer, positive association. Okay, exercise and coronary heart disease, negative association. Am I clear? So in your exam, possibly the question can be asked this way. Odds ratio means strength of association. Equal to 1 means no association. More than 1 means positive association. That means it's a risk factor. Negative association means it's a protective factor. Suppose I am doing physical activity and coronary heart disease. That means if you do physical activity, there is less chance for you developing coronary heart disease. If you smoke, positive association, more chance of developing lung cancer. Okay, fine. Answer the next question, guys. Answer the next question. In a study, doctor wants to check incidence of some disease in, the question is incidence in workers, band managers after sound exposure for 1 year between exposed and non-exposed group. What is this study design? Come on, answer it. What is this study design? Yes. Okay, this is the question. What is the study design? Yes. It starts from exposure to outcome. Okay, exposure to outcome. What is the study design? If it goes from exposure to outcome, then it is a cohort study. Cohort study. It is a cohort study, right? It is a cohort study. Cohort study, from the population select exposed and non-exposed. From them follow them. Disease will develop, no disease. Here this group, disease, no disease. What study is this? Excellent. Okay, this is a cohort study. Cohort study. So in a cohort study, what you can find is incidence. Okay, incidence. What is incidence means? What incidence means? Number of new cases. Incidence means number of new cases, guys. New cases. Okay, fine. Next. You can't find incidence in a case control study, because in case control study, I starts from outcome to exposure. Okay, so everything is over before the study starting itself. So incidence you can find, okay, in case control or cohort means you can find only in a cohort study. So in a cohort study, what are the things you can find? You can find relative risk. Okay, so 1 or 2 years back you had a question. Okay, relative risk. This also indicates strength of association. Same interpretation as odds ratio. Okay, equal to 1 means no association. The question usually comes from these areas, so try to understand the concepts. Okay, equal to 1 means no association. More than 1 means positive association, that is a risk factor. And less than 1 means negative association, that means protective factor. Okay, fine. So equal to 1 and no association. And second one, what you can find is attributable risk. Okay, attributable risk, it comes in percentage. How much percentage of disease attributed to, how much percentage of disease is attributed to the exposure. Suppose smoking and lung cancer, it comes as 90%. What do you mean by that? It comes in percentage. Okay, what do you mean by that? 90% of lung cancer is because of smoking. Okay, that's what we are discussing here. Attributable risk means how much percentage of disease attributed by to the exposure. Okay, fine. Attributable risk. Next question, guys. Answer the next question. A doctor doing a clinical trial in which error in clinical over-reporting of disease, there is a selection bias. Okay, so what is the answer here? Selection bias. Removal can be done by. Okay, so we are discussing clinical trial means preferably this is RCT. RCT means randomized control trial. RCT means randomized control trial. Okay, so this is, you are going to give a drug, guys. You are going to give a drug population. You select a sample. Suppose I have 2 drugs available. I want to find which drug is better than I have a new drug. I want to find whether my new drug is better than the existing drug for hypertension. Okay, fine. Now what I have to do is that I have to identify the hypertensive, select a sample, then you divide them into 2 groups. How I am going to divide them into 2 groups? This I am going to use a technique called as randomization. Okay, randomization. I am going to divide them into 2 groups. So drug A I am going to give, drug B I am going to give. The question is what? Okay, so the question is, there is a selection bias is there. Okay, how will you eliminate this selection bias? This selection bias is eliminated by this randomization. Suppose I have 100 people. How to divide them into 50-50 in each group? If I start doing it, I can create this bias. Am I clear? So I can create a selection bias. So what is the advantage? So suppose 100 people are there. I put everybody's name in a lot. The first person will go to group A, second person group B. Like that I can go. So what is the advantage of randomization is that it eliminates selection bias. Okay, it eliminates. We do RCT. Okay, because the RCT is one of the best study because this everything is in our control. Okay, so the selection bias is less there. Okay, fine. Next. Are you able to follow this, guys? Message me. Okay, fine. Media population is taken in. Okay, so we have this crude birth rate or crude death rate is there. Okay, crude birth rate and crude death rate is there. Okay, the formula for this crude birth rate is number of births. Its birth rate is also okay, same formula. So number of births, number of deaths during a particular year, 2022, by mid-year population multiplied by 1000. This is what the formula is. Okay, so the question here is the mid-year population corresponds to which date? The mid-year population corresponds to 1st of July, guys. Mid-year population, exactly mid-year. Okay, mid-year population. One more population we need to know. What is this census population? We should see census. Census we take 10 years once. That corresponds to 1st of March, guys. Okay, 1st of March. Okay, 1st of March. Mid-year population corresponds to 1st of July. Census population 1st of March. Okay, fine. We'll go to the next question, guys. Okay. This is a recent question. Okay, please answer this. A new drug is introduced in the market after which phase of clinical trial? Okay, so that means after which phase it will come into market. This is the question. Come on, think and answer. Okay, we have these clinical phases are there. Phase 1, phase 2, then after phase 3. So this is done. Okay, what is the use of phase 1? What is the use? Phase 1 is done. Phase 1 is will tell you the safety of the drug, safety, whether the what dose you will develop, safety. Phase 2 we do on patients. Phase 3 is RCT. We discussed RCT. We use the new drug with the existing drug, we compare it. After phase 3 it will come into market. Okay, market. Okay, after phase 3 it will come into market. In market we will do this post marketing surveillance. Okay, we do this post marketing surveillance. Okay, so phase 1, phase 2, after phase 3, that is RCT, it will come into market. The question is what? Okay, the question is what? Okay, after which phase it will come into market? So the answer for this question is phase 3, guys, phase 3. Okay, so phase 4, this is phase 4. We do this post marketing surveillance. This is phase 4. Okay, to assess the long term side effect, whether the drug is having a long term side effect. Thalidomide disaster you would have heard. Okay, so after long term, is there any side effects that can happen? Okay, answer the next question, guys. Answer the next question. An epidemic is the rapid spread of disease to large number of people. Okay, so the question is, a well of contaminated water can cause what type of epidemic? Okay, so we have these different types of epidemics are there. So first let us start with this single exposure point source epidemic, guys. Single exposure point source epidemic. Okay, suppose it will go like this. Okay, so you take time, number of cases, you take time and number of cases. Okay, so look here, after some time, suppose in your hostel they are making a non-vegetarian food, all of you are eating. After some time the acute diarrheal disease started increasing. So the number of cases will increase, then it will come down. Okay, that will increase and it will come down, right? Now we are seeing the first one, single exposure point source epidemic. So sharp rise and sharp fall will be there. The epidemic curve, we are talking about epidemic curve. The number of cases will sharply, it will increase, then sharply it will fall. All cases occur within one incubation period, only one peak will be there. Look at this, this is the peak, only one peak is there. All cases occur within one incubation period. All cases occur within one incubation period. Because all of you are eating at the same time, right? Okay, this is single exposure point source. Okay, but the question is what? A contaminated well. So answer for this is contaminated well will follow this pattern, common source, continuous exposure. So what will happen here? Sharp rise will be there. The number of cases will increase sharply, but gradual fall will be there. Gradual fall will be there. Okay, it will come down gradually. Okay, next, it occurs within one incubation period or more than one incubation period. Suppose there is a well is there infected with some diarrheal disease, cholera will take. So people are fetching water. Okay, somebody is fetching water today, somebody tomorrow. Yes. Okay, one incubation period, more than one incubation period. More than one incubation period. Okay, more than one incubation period. Okay, fine. So in both these conditions, there will not be any person to person transmission. Propagated epidemic, person to person transmission will be there. Person to, okay, that is COVID and all will come in propagated epidemic. Okay, person to person transmission will be there. Am I clear? Okay. So the first two, there is no person to person transmission for that epidemic. And propagated epidemic, we will have person to person transmission. Answer this question, guys. Answer this question. Which of the following is an indicative of severity of the disease? Come on, answer this. Yes. Severity of disease. Okay, severity, the answer is case fatality rate. Okay, severity, lethality, killing power, all are same. Okay, killing power of the disease. Can you tell me a condition which is having 100% case fatality rate? 100%. Yes, 100% case fatality rate is, that is rabies. What is the use of proportional mortality rate? Proportional mortality rate will tell you disease burden. Disease burden. One more thing also we'll talk about disease burden, that is DALY. Disability adjusted life years, that also will talk about disease burden. Proportional mortality rate, disease burden. And recently asked question, which one will tell you communicability? Communicability is given by secondary attack rate. Okay, secondary attack rate. Communicability will be given by secondary attack rate. Okay, fine. Survival rate, we have one more is there, survival rate, 5-year survival rate, probably you heard of. Okay, pathology and other subjects. Okay, cancers you would have heard. Okay, so 5-year survival rate will tell you prognosis. Okay, prognosis. Okay, we are talking purely exam oriented, we are teaching guys, purely exam oriented. I think this was asked recently in your exam. Secondary attack rate. Okay, fine. Communicability, secondary attack rate. Okay, we'll go to the next one guys. We'll go to the next one. Come on, answer this. This is a question in our context, you should be able to answer it easily guys. A healthy person, okay, got exposed to infected case, and now what is this? Yes, so we should know two terminologies here. One is isolation, second one is quarantine. Okay, come on, answer it. Isolation we do on whom? Okay, we do isolation on whom? We do isolation. Yes, isolation we do on patients. Okay, we do on patients. We don't want them to transmit disease to others. So isolation we do on patients. What is the purpose of isolation? So that others should not develop the disease. So when isolation will be done? Isolation will be done during the period of communicability. Okay, period of communicability. Okay, fine. Suppose measles, the period of communicability is 4 days before and 4 days after the rash. Okay, so you should not do isolation. You should do isolation after disease started. We have to do isolation for 4 days. Okay, after that, not much use. You have to do isolation the first 4 days following rash. Quarantine we should be doing for the longest incubation period. So you should do for the longest incubation period. Quarantine for longest incubation period we have to do. Can you tell me, suppose you want to do for COVID, how long you have to do the quarantine? Okay, yes, for an example, you will take COVID. How long quarantine has to be done? For COVID, the incubation period is how long? Okay, so 2 to 21 days. So if you want to do quarantine, you have to do it for how many days? 21 days you have to do. Okay, fine. That is ideal, fine. 2 to 14 days, sorry. Okay, quarantine, 14. Okay, 14 days. So if you want to do 14 days, you have to do the quarantine, ideally, fine. Next. We'll go to the next one, guys. We'll go to the next one. The next chapter which we are going to see is maternal and child health chapter, guys. Okay, yes, come on, answer this. So what is the minimum number of minimum number of antenatal visits as per our program? Our program says that the minimum number of visits is 4. 4 is the minimum. Repeated question in your exam. The first should be within the less than 12 weeks. Second between 14 to 26 weeks. Third visit is between 28 to 36 weeks. And fourth is between 36 to term. This is minimum number. Okay, what is the purpose? To identify high risk cases. How much WHO prescribes? Okay, based on WHO, the question very specifically says WHO, then it is 8 visits, guys. 8 visits. Okay, ours is 4. The limited, since we are in limited resource country, so we are keeping minimum number of visits is 4. Okay, fine. So what is the purpose? Purpose is to identify high risk cases. Okay, high risk cases. The antepartum hemorrhage is there. Okay, twin pregnancy is there. Okay, we are going to check everything. Okay, gestational diabetes. Okay, height. Okay, age. Okay, all these things we are going to check. So again, repeated question. According to WHO, maternal mortality is defined as. What is the answer? What is maternal mortality? Maternal mortality means women die during. Okay. So how many visits should Asha make after delivery? Asha, for a normal delivery, Asha should make 6 visits. Okay, 6 visits. Normal delivery. Okay. Mostly nowadays we endorse hospital deliveries only. Okay, normal delivery is 6 visits. Suppose LSCS means 5 visits. LSCS means cesarean section means 5 visits. 5 visits. If it's a home delivery, suppose the question very specifically the question says home delivery means 7 visits. But if nothing is given, then the answer should be 6 visits, guys. Answer should be 6 visits. What is a maternal mortality? Maternal mortality means women died during pregnancy. Keep asking question, guys. Okay, so pregnancy, delivery, or within 42 days of delivery. 42 days of delivery due to complications of pregnancy. Due to complications. Okay, due to complications of pregnancy. Now tell me what is the answer here. What is the answer? Due to complications of pregnancy. Yes. So the answer here is antenatal, okay, to within 6 weeks of delivery. 6 weeks. 6 weeks. The 42 days means 6 weeks. Postpartum period. What is the most common cause of maternal death in India? Hemorrhage, guys. Okay, hemorrhage. That is postpartum hemorrhage. That is the most common cause. Okay, fine. In India, what is the current value? Our MMR is 97 per 1 lakh live births. This is the only indicator we multiplied with 1 lakh, guys. Only indicator we multiplied with 1 lakh. The current value is 97. Okay, so able to follow this? Only indicator multiplied with 1 lakh. Answer the next question. Yes, answer it. A child presents with a normal height. Okay, but weight is less than that of expected for the height. So he will be classified as what? Okay, so first is for indicators of malnutrition. We have weight for age is there. Okay, weight for height. Weight for height. Height is good, but weight is less. So that we call it as what? Wasting. And third is height for age. Height for age. That we call it as. So that means for that particular age, okay, how much the weight the person has achieved. Okay, that we call it as stunting. So weight for age, weight for height, and height for age. Okay, so this is the answer. Wasting. The question here, normal height but weight is lesser. So answer is wasting. Wasting. Okay, fine. So we have this which are out of this, which one is indicates acute malnutrition? The first two indicates acute malnutrition, guys. Acute malnutrition. Height for age indicates chronic malnutrition. Okay, the first two indicates acute. The last one is height for age indicates chronic malnutrition. Okay, fine. So hope you are following this, able to follow. Yes or no? Okay, just put it in the chat box, guys. Chat box. In a school health scenario, school health guideline says that. Okay, fine. So what are the norms the school health guideline says that? The minimum square feet per student is, okay, 10 square feet, guys. 10 square feet per students. Okay. So maximum is how many students means 40 students in a class, not more than 40 students. So light should come from left side, it should come. Okay, so light should come from the left side, not from the front. Left side it should come. Minimum 40 students. There should be one urinal should be there for every 60 students, and one latrine should be there for every 100 students. One latrine should be there for every 100 students. Okay, and doors and windows. Doors and windows for ventilation, doors and windows should be 25% of the floor area. Okay, 25% of the floor area. Able to follow? This is what school health guidelines says. This is what school health guidelines says. So, and this is also right. So the minus desk. Okay, right now I'm sitting in a minus desk. My table is there. My legs are inside. Okay, my normal any desk. Okay, my hands are rested on the table and I am writing. Okay, fine. This is minus desk. So this is right. All others are wrong here. Okay. So you get problems also. Okay, answer the next question. Newborn rate is 25 per 1000. And what is the estimate the total number of pregnancies? The question is, they are asking estimate the total number of pregnancies. Nowadays I am seeing one or two problems in your exam. Okay, so here the formula to calculate total pregnancies. Okay, that is, first is expected number of live births. Y is equal to crude birth rate multiplied by population divided by 1000. Okay, crude birth rate multiplied by the population divided by 1000. This is expected number of live births. So Y is equal to 25. What is the population they are given? Is the population they are given is 5000. 5000 divided by 1000. Okay, fine. So how much it comes? Okay, so 125. This is expected number of live births. Second component is that the expected number of pregnancies. Expected number of pregnancies. Okay, Z is equal to Y plus 10% of Y you are supposed to add here. Okay, so you have to add 10%. This we call it as pregnancy wastage, guys. Okay, this is wastage. Okay, abortion could have happened, stillbirths could have happened. This is pregnancy wastage. Okay, fine. Now how much is the value? Okay, value kitna hai? Okay, so Z is equal to 125 plus 10% of Y. Okay, 10% of 125 kitna hai? So that is 12.5. So you can round it off. Z is equal to, okay, 137.5. That is 138. This is your exam question. Okay, so this you should be able to answer it, guys. Okay, so your exam question. Whatever we are discussing, these are past year exam questions only. Okay, last 3-4 years. Okay, fine. you'll go to the next one. This is expected number of live births. 2 steps. First step is that expected number of live births Y. Then you have to add 10% to it. Okay, that is pregnancies. Suppose pregnancy wastage could have happened. Next. Answer the next question, guys. Breastfeeding should be continued for a minimum of how many months? Yes, breastfeeding. Okay, so it should be started for a normal delivery within 1 hour. For LSCA, cesarean section, within 4 hours. So breastfeeding should be started as early as early as possible. If it is possible, that is well and good. But at least by 1 hour, we should start following a normal delivery. Following cesarean, we should start within 4 hours. Okay, fine. So exclusive breastfeeding is for 6 months, and continued breastfeeding is for 2 years, guys. Okay. WHO recommends, along with the other food, you should give breastfeeding for 2 years. So, but the question here is how many minimum months continued? Okay, that is exclusive. They are asking 6 months. You have to give it for 6. No other food is required. You just give breastfeeding. That is more than enough. Okay, for this first 6 months. Next question. Breast milk is vitamin K is deficit, vitamin K, but we can't say vitamin C. Vitamin K is deficient, that's why we give this vitamin K injection. But vitamin C is more when compared to cow's milk. Okay, vitamin C is more in breast milk when compared to cow's milk. Best index for measurement of health status of the society. Okay, what is the answer? This year NEET question, NEET exam question. Okay, health status is measured by infant mortality rate. Under 5 mortality rate measures social development and well-being. Okay, under 5 mortality rate is social development and well-being. Under 5 mortality rate. Okay, and we have this perinatal mortality rate. Okay, perinatal mortality rate. Okay, perinatal mortality rate measures. It's an indicator for pregnancy wastage. It's an indicator for pregnancy wastage. Perinatal mortality rate. So the first one, social development and well-being. Okay, that is under 5. Infant is health status of the community. Perinatal mortality, pregnancy wastage, guys, wastage. Okay, again, this is the next question. It's a problem. Okay, the question is they are asking calculate neonatal mortality rate. Neonatal mortality rate, that is a question. Neonatal mortality rate means deaths between 0 to 28 days. Okay, the formula for NMR I will write. Neonatal mortality rate is neonatal deaths, denominator is number of live births multiplied by 1000. That is the formula. Neonatal deaths, number of live births multiplied by 1000. Okay, fine. Now, what is this neonatal deaths? Okay, we will see. Live births they are given is 4000. 4000. Okay, so total deaths 0 to 7 days is 40. 7 to 28 days is 40. So 40 plus 40 multiplied by 1000. So ours is neonatal deaths. First you have to understand what is neonatal deaths. Neonatal period is 0 to 28 days. Post neonatal period is what? 29 days to 1 year. Infant mortality, infant deaths means 0 to 1 year. Infant means 0 to 1 year. 0 to 1 year. Right. Now you just see this. So what will be there? 80 by 4000 multiplied by 1000. The answer is 20, guys. 20. Not 20. Okay. 20. 20 is right. 20 is right. 80 by 4. Okay, 80 by 4, 20. Are you guys able to follow this? Put it in the chat box. Able to follow? We'll go to the next topic. Sociology. You are getting 1 or 2 questions from this topic. 1 or 2 questions. So, to my knowledge, the most important areas for your exam is demography, communicable disease, that we will see tomorrow. Okay, these are the number of questions was 10 to 12 questions from these 2 topics alone it comes. Okay, fine. Now, a married couple has 1 childbirth recently. They belong to which phase of the family cycle? The question is family cycle. Okay, fine. So I will show the image from the textbook of Park. We will learn from that. Okay, anyway, I will send this PDF. I will send it. Okay, fine. These are the phases. Okay, fine. So first stage is formation family life cycle. Okay, so it happens to us, for me also, for you also this happens. Okay, so from marriage to birth of the first child. Okay, शादी होने के बाद, okay, till the time there is first childbirth. Extension is birth of first child to birth of last child. That is extension. Your family is expanding. Okay, fine. Complete extension. Birth of last child to first child leaves the home. Okay, they want to study or they are getting married. Probably they are getting married. Okay, fine. Contraction. First child leave homes to last child leave the family. Okay, fine. Completed contraction. Last child has left the parents to first spouse dies. Okay, as a couple, the first one dies. Dissolution. First spouse dies to the death of the survivor. Okay, this is dissolution. Okay, fine. This is the image from the textbook of Park. Okay, and we are getting this question. Okay, not only in your exam, we are getting the question even in INA exam also. We are getting this question. Okay, fine. Now answer this. What is the answer here? We'll go back to the question. So has 1 childbirth recently. Then what is the answer? Yes, it's not formation. Okay, so there is already a childbirth is there. Okay, fine. Yes. So then it goes for extension. Okay, extension. Formation means before the first, before. Okay, end. Now the phase has started. Okay, the birth of first child. Before this 2 phase. Okay, formation means marriage to first child birth is there. First childbirth. Okay, now baby has born. This is extension. Next question. Okay. I will let you know, guys. Okay, that the Telegram group will be there. Okay, Telegram group. In that group, they would have been posted. Okay, fine. I'll let you know. Mostly it will be there. Okay, fine. End of the formation. Now, a child has IQ level of 55. He is having what? IQ level of 55. Okay, so that is intelligent quotient. Okay, so we have multiple classification. We have 2 types. First one we will see from the textbook of Park. We will see. Okay, this is IQ means mental age by chronological age. This is IQ, and we have this idiot means 0 to 24 IQ level. Imbecile means 25 to 49. Moron means 50 to 69. Borderline means 70 to 79. Okay, so normal means 90 to 109. Okay, so we ourselves will assume that 140. Okay, so we consider ourselves as genius. Okay, fine. Now, okay, so we consider ourselves as genius. Fine. Now the question here is genius. Now we will see the one more classification that has been asked here. Okay, fine. Mild mental retardation means 50 to 70, guys. 50 to 70 is considered as mild mental retardation. Moderate means 35 to 49, IQ level of 35 to 49. Severe means 20 to 34, and normal. Okay, 70 to 79 is, we consider this low IQ. And profound IQ. Profound, what is profound? Profound means very severe. Very severe means less than 20. Okay, less than 20. So what is the question here? Okay, what is the question? The IQ level of how much? 55. Okay, 55. 55 is not moderate, guys. Is it 55? Is it moderate? Okay, so 50 to 70, it is within the range. 50 to 70. So what is this? This is mild MR. Moderate means 35 to 49. That is moderate. Severe means 20 to 34, and profound means less than 20. I will check on the Telegram group regarding the PDF. I will check it on guys. Now, next question. This is a new area. Now we are getting questions. Okay, fine. A doctor is teaching an intern about knee reflex demonstration. What type of learning is this? So listen. So we have 3 domains of learning. Okay, domains. One is cognitive domain. It focused on the knowledge. It focuses on knowledge, cognitive domain. Okay, affective domain. Okay, it focuses on emotions and communication. Affective domain. Okay, emotions and communication. Psychomotor domain, it focuses on skills. Okay, skills. So suppose as a teacher, okay, so as a teacher, sometimes I have to focus on your cognitive domain. That means focus on your developing your knowledge. Psychomotor domain, focusing on your skills. Okay, how to do percussion, how to do palpation, okay, how to do peripheral smear. That is psychomotor. Affective domain means, okay, so how to teach you the values. Okay, how to teach communication skills. Okay, fine. Now the question here is, the doctor is, okay, teaching an intern on knee reflex demonstration. Okay, so I am teaching you how to do knee reflex. So what type of learning is this? Yes, can you tell me learning, what type of learning? So I am teaching here the skill. Okay, skill. So this becomes psychomotor learning. Okay, psychomotor domain. Okay, teaching skills. Okay, skills. Cognitive domain is knowledge. I can ask you a question. Tell me 5 causes of hepatosplenomegaly. Okay, so here that's a knowledge domain. I'm checking your recall level. Okay, so that is cognitive domain. Okay, suppose I ask the student, okay, counsel a patient. Okay, patient came for diabetes, you counsel the patient. So that is what? That is affective domain. Okay, I'm asking you to check, okay, whether the patient is having a splenomegaly. Demonstrate splenomegaly. Then it becomes psychomotor learning. Okay. Components of Kupusamy scale. So this is a scale used for Kupusamy scale for socio-economic status, guys. Socio-economic status. Okay, this is a scale for looking into socio-economic status. Okay, it includes 3 things: income, occupation, and education. Okay, so this is, we have one. So look here. So this is a table from the book. Okay, so education of the head of the family. Occupation, head of the family. Okay, fine. Income, family income. Okay, this is a family income. Based on this, they will be telling you the socio-economic status. Okay, socio-economic status about a particular family. This is Kupusamy scale. We have one more is there, that is called as modified Prasad scale. This is also used for socio-economic status. This will focus on modified Prasad scale. Okay, it is based on per capita income. That is income per person. Okay, income per person. Okay, that one is Kupusamy scale is based on Head of the family, education, occupation and family income. Okay, fine. Next. These are some of the points from sociology, guys. Sociology chapter. Next. We'll go to the next topic. This is a concept of health and disease, levels of prevention. On a Republic Day, a camp was organized and people are screened for hypertension and checking blood pressure. What level of prevention? Okay, can you tell me what are the different levels of prevention you know? Different levels of prevention. Can you tell me? Yes. What is primordial prevention? Can you tell me what is primordial prevention? Okay, fine. So primordial prevention is, okay. So above poverty line, below poverty line is based on income we use it. Okay. So we have a cutoff value and the cutoff value, government fixes the cutoff value. So you should have this much. Okay, so they have a cutoff value. Based on that, we classify them as above or below poverty line. Okay, this is ourselves we can do it. Okay, so what is primordial prevention? Prevention prior to risk factors. Before risk factors itself, we are doing prevention. This is primordial. Second, what is primary prevention? So primary prevention is prevention before disease. That means risk factor may be there, you are preventing before disease. What is secondary prevention? Okay. Action, that means disease have started. Action that halts the progression of disease. Progression of disease. Action that halts the progression of disease. That means disease have started, you are trying to stop it at an early stage. Okay, fine. Both. Okay, secondary and tertiary. Measures taken to reduce, okay, measures taken to reduce disabilities. That is tertiary prevention. Okay, before risk factors, primordial. Before disease, primary. Disease have started in secondary, and tertiary means measures taken to reduce disability. Okay, fine. Now, okay, now tell me what is the answer. We'll go back to the question. What is the answer? Okay, fine. What is the answer? So we are searching for case. We are screening. So we are searching for case. Since we are searching for case, any screening programs comes in secondary level of prevention. Anything we are searching for the cases, guys. Cases. Okay, fine. Okay, fine. Answer the next question. In Africa, vaccination was given in an endemic outburst area and mass chemoprophylaxis was given. Okay, they are asking which type of prevention they are asking. Okay, fine. Now, so this is actually intervention, guys. This is intervention. Okay, intervention for primary prevention. For primary prevention, we can do health promotion and specific protection. You can do specific protection. Okay, so what is the answer for this question? For primary prevention, you can do health promotion, you can do, and specific protection. Health promotion means what you can do. You can give health education, go to children, okay, health educations, okay, environmental modification you can do, okay, you can avoidance of water stagnation, okay, so those things, okay, environmental modification, okay, so those things, okay, lifestyle modification you can do, okay, and you can nutrition intervention you can do. Specific protection, you can, what you can do, specific protection, vaccination, okay, chemoprophylaxis. So all you can do. This is for primary, guys. This is for primary prevention. Primary. Secondary prevention, what you can do? Secondary. Okay, fine. Secondary prevention, you will do any test screening. Okay, AFB, acid fast bacilli, pap smear, any screening will come in secondary prevention. Okay, specific protection. Okay, specific protection. Specifically, you are protecting against a particular condition. Specifically, you are going to do it. Okay, fine. Now, what is the answer for this question? What is the answer? I'm giving mass chemoprophylaxis. Okay, so mass chemoprophylaxis I'm giving. So what is the answer for this question? Is mass chemoprophylaxis. Answer for this question is specific protection. Specific protection. Am I clear? Okay, specific protection. Tertiary, we can do disability limitation and rehabilitation. Tertiary. Okay. Okay, disability limitation and rehabilitation. Okay, rehabilitation. Rehabilitation. Okay, tertiary prevention. So am I clear? So these are the points you should know regarding prevention, guys. It's a commonly asked question in your exam. Now, this one you should be able to answer. Come on, what is the answer for this question? TB sputum assessment comes under which are the following mode of prevention? Yes. I am checking for sputum. Sputum is for what mode of prevention? Excellent. Okay, this is secondary prevention. Secondary. Okay, I am looking for sputum. Okay, for we do this Ziehl-Neelsen technique. To sputum we take. I am searching for cases. Okay, so that means it comes in secondary prevention. Secondary prevention. Next question. Two questions from screening we will see. Screening test is used for a disease. Okay, answer what is this line? So this is the natural history of disease. Okay, so first A point is disease onset, B point is first possible point of detection, C point is critical point of diagnosis, D is usual time of diagnosis, and E is outcome. Okay, fine. Now the question what they are asking here is what is these 2 points? This is one question. And second question is what is the gap between these two? Okay, 2-3 questions only come from this topic in your exams. One is this, the second one between B and D. This is called as lead time. Okay, you are having a screening test and a diagnostic test. The time between the first possible point and usual time of diagnosis, that is lead time. Between B and C, okay, so for example, sometimes we may have cancers. For cancers, we have a final critical point will be there. That means anything beyond this point, it's not going to change the outcome. For a cancer, maybe metastasis. Okay, following metastasis, it's may not going to change the outcome much. So between B and C, so this point is called as screening time. Okay, screening time. Screening time. That means if at all, if you want to do screening, it's better to do in screening time. So the question is between B and C. So the answer for this question is screening time. Commonly asked one is, this one is more commonly asked. What is lead time? Okay, so first possible point and usual time of diagnosis. Okay. Certain terminologies we will learn here. What is sensitivity? Sensitivity, we are in screening chapter. We are comparing a screening test with a diagnostic test. Let us take pap smear as a screening test and biopsy as a diagnostic test. Okay, what is sensitivity means? Ability of the screening test to identify true positives. Okay, so you can remember ability of the test to identify true positive. That means diseased people. Okay, whether this screening test can able to identify the diseased people, whether pap smear can able to identify the diseased people. Okay, that becomes okay true positives. Okay. What is specificity? Specificity means ability of the test to identify true negatives, whether it can able to identify non-diseased people. True negatives means non-diseased people. Okay, fine. Ability. Okay, suppose this I am having a pap smear, whether the pap smear can identify diseased people, that means sensitivity. So whether the pap smear can able to identify non-diseased people, that is specificity. Okay, fine. Now, what is positive predictive value? Positive predictive value means probability a person with a positive test having the disease. What is the probability a person with a positive test? Okay, I'm not going deep, basic outline only I'm giving. Okay, fine. What is the probability? Okay, a person with a positive test is having the disease. So this positive predictive value, PPV I will write, it is directly proportional to prevalence. This is what the question is. Okay, prevalence. That means more the disease prevalence, more the prevalence, okay, positive predictive value will be also more. This is what the question is. The positive predictive value and prevalence are directly proportional. Directly, more the prevalence, more the positive predictive value. Okay, fine. Is it clear? Fine. Next. These are the common questions. 4-5 questions only. So what is lead time? What is screening time? What is sensitivity? True positives. Specificity means true negatives. And what is the relationship between prevalence and positive predictive value? Directly proportional. Come on fast. Okay, these are easily you should able to answer. Come on. Which biomedical waste bag should be disposed for incineration? Yes. This you should able to answer it fast. Yes. Okay, for incineration, okay, that means the answer is yellow color bag. In yellow color bag, what are the waste you are going to put? So, anatomical waste. Okay, commonly asked question I will put. Okay, anatomical waste. Okay, fine. Next, blood bags. This is also commonly asked. Blood bags. Chemical waste. Liquid chemical waste. Okay, fine. Chemical waste should be going. Okay, blood bags. Soiled waste. Soiled waste. Okay. Microbiological waste. Microbiological waste. So these are the waste we should take it and put it into this incinerators. Okay, so high temperature dry oxidation process. So recently asked one is another one is blood bags. Okay, so it should go to yellow color bags, guys. Okay, yellow color. Now, what we will put it in the blue color bins? Okay, others will see. Blue color bins, what we can put? Okay, fine. Blue color bins. So here also drugs also will come. Discarded medicines. Okay, blue color bins, glasses. Okay, vials will be there. Okay, vials, ampules, metallic body implants. Okay, metallic body implants. Okay, that goes to blue color bins. Okay, pacemaker. Recently asked one is pacemaker. Pacemaker is a metallic body implant. Okay, that also should go to blue color bin. Okay, answer the question, guys. A training is given to the A&M worker. Okay, so you are the medical officer. She is having cotton, lunchbox, syringe, needle after immunization. Which are the following is true? Okay, syringe with needle in translucent white container, used vial in translucent white container, cotton swab, okay, in yellow bag, okay, food waste, okay, so in blue. Okay, this is wrong. Vial should go to blue color bin, right? Okay, vial should go to blue color bin. Okay, so syringe with needle. Syringe with needle actually. Okay, fine. Cotton swab. Okay, cotton. Okay, cotton swab. Okay, for me. Okay, so this is immunization. Okay, this is immunization. Generally syringe should go to red color bin. We have to do this. What is this? We have to cut the needle and it should go to red color bin usually. Okay, but for immunization, okay, this is also right, this is also right. Okay, this is also right. Cotton swab, yellow color bin. Okay, so you have given soiled, it's soiled. Okay, maybe blood may be there. Okay, so it should go to yellow color bin. And syringe with needle. Okay, syringe with needle. Okay, and it should go to white container. Okay, so both may be correct, but if they ask only one, okay, we can go with this. You can go with this. Okay. Answer the next question, guys. Answer the next question. Recycling tubing, recyclable catheters will be disposed in which of the following biomedical waste? Okay, so this is, what is the answer for this one? Yes, it is red color. So what are the bins you can put here? Yes, red color means, okay, rubbers, tubes and catheters. Okay, so you can what are the things you can have? Gloves, recently asked, gloves. Okay, syringes. Okay, gloves, syringes. Okay, fine. Then we have this saline bottles. Okay, saline bottles. Okay, maybe a saline bottle, syringes, gloves, and catheters. Okay, so all these things should go to red color bin, guys. Okay, these are recyclable waste. White bag is used for disposal of what we already discussed. So this is glassware, and what is the other one? Metallic body, metallic implants, K-wire, some needles are there. Okay, pacemakers. Okay, so these are metallic implants. White bag is used. What is inertization? Inertization we used for dispose. Okay, dispose pharmaceutical waste. Suppose you have drugs are available. Okay, pharmaceutical waste. Suppose you have drugs available, so you want to there is no alternate, so you have to do deep burial of the drugs. So what you can do is that you can take 65% of pharmaceutical waste and 15% of lime, 15% of cement, 5% of water you can add. If you yes, question you can put it guys. Okay, so if you have 15% of all these things, this will get solidified. Okay, solidified, then you can do deep burial. Based on this, can you tell me what is the answer here? This is not incineration, guys. The question is inertization. This is not incineration. The question is inertization. What is the answer? 15% lime, 15% cement, 5% water, solidified. Okay, so how this will be helpful? Yes, this is used this to avoid water contamination, guys. Okay, Vishwajit Singh. Okay, what is your query? Okay, post your query. Fine. So to avoid water contamination. Okay, fine. Next. Next question. Patients are categorized, okay, based on the chance of survival in disaster management. Yes, this is called as disaster management, chance of survival. Yes, the answer is triage, guys. Triage. Okay, what is triage? You are classifying injured people based on the chance of survival. It should be done at the site of disaster. Okay, so hospital will be overcrowded, so you are going to classify them at the site of disaster itself. So if you classify them, red means high priority. The person is a high priority. Red means high priority. Yellow means medium priority. Green means ambulatory. Green means ambulatory. Okay. Black means dead, actually dead. The multiple time repeated question, guys. Multiple time. The concept is. So where will you do the triage? You have to do it at the site of disaster. Red means high priority, yellow medium, green ambulatory, black is dead. Okay, recently also we had questions last year in NEET exam also. In your exam also this question was asked. Okay, which are the phases of disaster cycle before disaster impact includes? Okay, the disaster cycle, so it starts with impact. So after that it is, okay, response phase following a disaster. So it will go with response phase. So then relief phase will happen. Okay, suppose there is earthquake is there, people will come and respond. Then relief phase will happen. Following relief phase, rehabilitation will happen. Rehabilitation, people would have lost houses, families. Okay, we have to do rehabilitation. After this we can do certain things. Mitigation we can do. This we can do before disaster. What is mitigation means? Measures taken to reduce the impact of the disaster. Okay, suppose in Japan you take, okay, very much earthquake prone country. Okay, so if you see some parts of Japan, they construct houses in woods. So even if earthquake happen, okay, so loss of lives will be prevented. That is mitigation. And preparedness you can do. Okay, preparedness, this is before disaster you can do. So nowadays you can see TV, radios. Okay, suppose a cyclone is going to come. Okay, we are taking all the precautionary measures. Okay, so who's supposed to do what, flood comes means where they are supposed to go. Okay, so we are prepared actually. So that is preparedness. Okay, so the question is phases before disaster. So before disaster means, okay, this is the answer, mitigation and preparedness. So we can do it before the disaster itself, we can do it. Okay, fine. Yes. Next. The same question was asked in your exam also, NEET exam also. Okay, so you have to study both set of questions, you have to study. The ANM receives 2 open vials, one MR, another one is pentavalent. Okay, so which can be used for the next immunization round. So this concept is called as open vial policy. Okay, open vial policy. Normally BCG, MR, JE, Rota all should be used within 4 hours. Once you open this vial, it should be used within 4 hours, guys. 4 hours. Okay, that means during immunization session, once you open it, it has to be used within 4 hours. BCG, MR, JE and Rota. Under open vial policy, all remaining vaccines. Okay, I will discuss what are the vaccines in the National Immunization Schedule. So all remaining vaccines in the National Immunization Schedule can be used for 4 weeks. Okay, can be used for 4 weeks. These 4 vaccines, okay, recently some changes are there, but you stick on to this. This is what is given in the textbook. Follow the textbook. Okay, BCG, MR, JE, Rota all should be used within 4 hours. Under open vial policy, remaining all vaccines can be used for 4 weeks. 4 weeks. Fine. Next. Okay, so now what is the answer? Okay, pentavalent. Okay, what is the answer? Yes, what is the answer? Okay, so MR you have to discard it. Pentavalent you can use it for 4 weeks. Okay, fine, right. BCG is diluted with what? BCG comes in powdered form. Answer is normal saline. BCG comes in powdered form. Okay, so you have to normal saline. And distilled water, this is for MR vaccine. Distilled water, we use it for MR vaccine, right? Now, so orally, what are the vaccines we give? Orally, we give OPV and rotavirus, guys. OPV and rota. Intradermally, so intradermally we give BCG and IPV, injectable polio vaccine. Injectable polio vaccine, okay, BCG and IPV. Subcutaneously, okay, subcutaneously we give MR and JE. MR and JE vaccine we give subcutaneously. All other vaccines we will give IM, guys, okay, intramuscularly. So orally, OPV, rota, intradermally BCG and IPV, all other vaccines we give at all other vaccines, subcutaneous MR and JE, all others we give intramuscularly. Okay, fine. Now, we'll go to the next question. In a PHC, where the vaccine storage is done. Okay, fine. Remember, PHC, we store the vaccines at ILR. This is called as ice-lined refrigerator. Ice-lined refrigerator. So it will maintain the temperature of +2 to +8 degrees Celsius. +2 to +8 degrees Celsius. Ice-lined refrigerator. One more equipment will be there in a PHC, that is called as deep freezer. That will be between -15 to -25 degrees Celsius. Okay, what is the use of deep freezer? Deep freezer is for making ice packs. Okay, deep freezer for purpose is for making ice packs. Okay, -15 to -25 degrees Celsius. Ice-lined refrigerator +2 to +8 degrees Celsius. Vaccine carrier. Okay, this is will be used in sub-centers. Okay, Anganwadi. Okay, they will be using vaccine carrier for carry the vaccine. So it will have 4 ice packs. It will have 4 ice packs. Okay, how many ice packs it will have? 4 ice packs it will have. Okay, and we will carry the vaccines in the vaccine carrier. Okay, fine. So am I clear? So what is the ideal temperature for vaccine is? This is the ideal temperature, +2 to +8 degrees Celsius. That is the ideal temperature for the vaccine. Okay, come on, answer this question. Okay, last few questions. 7 o'clock we will finish it. Okay, fine. Yes. Which vaccine is given at birth? Okay. So we will discuss the National Immunization Schedule. Okay, National Immunization Schedule. Okay, National Immunization Schedule. At birth, we give BCG, OPV 0 dose, and hepatitis B. Okay, walk-in cold room won't be there in CHC, guys. Okay, walk-in cold room will be there at regional level. Regional level means 4 to 5 districts it will have. Okay, the entire room they will maintain the temperature and they will store the vaccines there. Walk-in cold room, not at CHC, not at CHC. Okay, fine. At birth. Okay, fine. 6 weeks. What are the vaccines? 5 vaccines we are going to provide. What are the 5 vaccines? Okay, OPV 1. Okay, Rota 1. Pentavalent 1. And what we are not, we have 2 more vaccines are there. We have this pneumococcal. Okay, pneumococcal 1. IPV 1, injectable polio vaccines. 10 weeks, OPV 2, Rota 2, Penta 2, 10 weeks. Okay, 14 weeks. Okay, OPV 3, Rota 3, Penta 3, pneumococcal 2, IPV 2. Okay, fine. 6, 10, 14 weeks. 6, 10, 14 weeks. Okay, fine. 6, 10, 14 weeks. 9 months. 9 months we are going to provide. Okay, so MR1, JE1, Japanese encephalitis 1. Okay, pneumococcal, PCV I will write, PCV booster, pneumococcal booster. We also give vitamin A, we will give. Again 16 to 24 months. Okay, MR2, JE2, OPV booster, DPT will give, okay. 5 to 6 years. 5 to 6 years, we give DT or TD, and 10 years, 16 years, okay, pregnancy. In all these times, 5 to 6 years, we don't give DT, we give DPT. Okay, DPT. 10 years, 16 years pregnancy, we will give this TD vaccine. Nowadays, we don't give tetanus alone. Okay, we will give diphtheria along with the tetanus. Okay, the age incidence of diphtheria is increasing, we are giving it. Okay, fine. Now, this is the national immunization schedule. We are talking about national immunization schedule. Okay, fine. Now we'll go back to the question. You answer me what is the answer for that question. So, question here is which vaccine is given at birth? Okay, so BCG, OPV, and first answer is right, guys. First is right. Okay, fine. Next question. Okay, 3 more questions. Fine. As a medical officer of PHC, you want to talk and discuss health related issue to antenatal mothers. So what is this? How many people will you include this focus group discussion? Okay, this is a type of health communication. The question starts from. So it's a type of health communication. Okay, so health communication. 6 to 12 members. Okay, they form a circle, and within the circle they will sit and they will discuss. Okay, 6 to 12 members. Okay, they will sit and they will discuss. This we call it as focus group discussion. Okay, they will talk. Okay, so there should be, who should be there means a leader should be there. Okay, a timekeeper should be there, timekeeper. Okay, so note taker should be there, note taker, and everybody should participate. Okay, everybody. Okay, suppose they should participate, everybody should participate, they should talk. Okay, what is their concerns? Okay, and it is an effective method of health communication. It is an effective method of health communication. Okay, health communication. Am I clear? This is focus group discussion. 6 to 12 members, they will sit and discuss. Fine. Best radical new approach for health education. The question is based on approach. We have 4 approaches there. First is regulatory approach. Listen, the subject, lot of facts will be there. Discussing lot of facts and concepts. Okay, and so what is this, the regulatory approach? Okay, so even though it's a good thing, government is forcing us to do certain things. For example, helmet. They say that if you are not wearing helmet, mask, we will put fine. That is regulatory approach. The second one is service approach. Providing services at doorsteps. So government thought that, okay, in rural areas we don't have people are not using toilets, so let us construct toilets for them. Okay, let them use it. That we call it a service approach, but people are not using that. Okay, without identifying the needs of the people, they constructed the toilets and they are giving it. People are not using it. That is service approach. The third is health education approach. Okay, third is health education approach. Okay, that we do. Okay, fine. The fourth is primary care approach. Fourth is primary care approach. Okay, involving people. Okay, for this health education. Example is ASHA. Okay, and we have a committee called as Village Health Planning and Nutrition Committee. Okay, village health. Okay, we have a committee called as Village Health Planning, that is involved in village health planning. Okay, Village Health Sanitation and Nutrition Committee. Okay, this committee, they themselves plan for the village. So out of this, all approaches, which is the best approach, means the primary care approach is the best approach because it is involved in planning by themselves. Okay, so regulatory approach, even though they say whatever they want to say, people are not using helmets. Okay, service approach is not that much useful, but the best approach is primary health care approach. Okay, that is, people are planning for themselves. Okay, fine. This is the last question, guys. Okay, this is the last question. Okay, if you want to teach how to prepare ORS in a village, which method will you use? So you want to use, what is this? This is a skill. Okay, how to teach a skill? Will you take lectures? Will you do flashcard? Which one will you use? Okay, the best one is demonstration. Okay, it's a multiple time repeated question. It's demonstration, guys. Demonstration. Okay. Role play. When will you use role play? Role play, you use role plays. When we use is that whenever there is a sensitive topic is there. Sensitive topic. Okay, you can use role play. When the audience is children, you can use role play. Okay, fine. Panel discussion, you can use panel discussion as a method of health communication. Okay, 4 to 8 experts, they can sit and talk. Okay, they discuss as an audience, we can observe them. That is panel discussion. Okay, so these are some of the topics, okay, which we have as a part of recent questions from your exams. Okay, so we have gone through these questions, guys. Okay, fine. Okay, so thank you. Okay, you can access us in this YouTube. Okay, PW MedED YouTube channel. Okay, Facebook we have. Okay, in these Instagram page we have. Okay, so you can access our videos. Okay, you can access to our live content. So thank you very much. Okay, demographic cycle. What is demographic cycle? Means every country will go through. Okay, over a period of time, it will go through from one phase to another phase. For example, high stationary countries in high stationary, then gradually it comes to early expanding, then gradually to late expanding, and low stationary. Okay, you ask your grandparents how many children they had. So at the time, high birth rate and high death rate will be there. So over a period of time, okay, so death rate is coming down, then birth rate is also coming down. So India is currently in late expanding. That means birth rate is also lower little bit, and death rate, both are declining. Germany and all is in declining phase, where death rate is more than the birth rate. That means number of people dying in a year is more than that of number of people born in a year. So population is going negative balance. Okay, fine. Okay, fine. What is the information you want for MBBS? Admission process. What is the information you want for MBBS? Little information about MBBS. Okay, fine. Okay, so we'll see tomorrow, guys. Okay, listen, this is an important subject for your exams. Okay, we completed only one half today, so remaining things we will complete tomorrow. Okay, thanks for listening. Okay, so we will see tomorrow, guys. Tomorrow same time. Okay.